So tell us a little bit about sort of these skinny shots. And let's start with, I think, maybe some of the names that people know the best. It may be the Ozempic and Wegovy, the semaglutide, and what that is.
Yeah, so semaglutide, which is the medication that's in Ozempic and Wegovy, and then Tirzepatide is the medication that is in Mounjaro and Zepbound. They really started out as diabetes medications, and they're really work by stimulating the pancreas to secrete insulin. And what these drugs are is they're really peptides that are released by your own gut, the cells in your gut, specific cells, and they work as a feedback loop to tell your stomach that it's full and to tell your brain that you've eaten and that you don't need to eat further. So these medications are really just mimicking those peptides, and they work at for Ozempic, or the semaglutide works at the GLP-1 agonist at it works at that receptor, and then Mounjaro works at the GLP-1 receptor, but also the GIP receptor. So it works at two different receptors.
So for the lay people in the audience on those receptors, I mean, that's probably the main difference. But in what case would you say, okay, we're going to start you over here on the semaglutide versus the tirzepatide? Or in what cases might you prescribe one over the other? And is one better than the other?
Well, I think for a lot of people, semaglutide might work, and it does work. Tirzepatide was just FDA approved for weight loss late in 23. So the studies look awesome. I mean, there's more weight loss with the tirzepatide and with fewer side effects. So more weight loss, fewer side effects. It does cost slightly more, and it works at two different receptor sites instead of one. So it's really up to the patient initially what they would like to try. And then from then on, it's just based on their experience. If they're tolerating whichever drug they choose, we would just stay with that. And we gently increase the dose over a period of months as they tolerate it.